drugs and their antidotes. Like, why we need to remember this? Okay, I'll tell you. For example, you are in an emergency situation, emergency duty actually. So in that, someone came to you after taking 20 or 30 tablets of paracetamol, like 100 tablets of paracetamol, and she started getting adverse effects on paracetamol toxicity, paracetamol poisoning, you call it as. So in that case, you need to give some drug to counteract the drug. To counteract the drug she have taken. So she have taken paracetamol, so to decrease the adverse effect of that drug, you will have to give the antidote. Okay, in that case you will need to remember what is the antidote you need to give to a paracetamol poisoning. So in this cases, like emergency duty time, or in this cases when you will be practicing, that time this will be helpful for you a lot of times. And also in the exam they'll also ask you from many past exams. May have seen many papers like in that they used to ask like, what is the antidote of paracetamol? Most asked question. Okay, so let's start the class now. And also we are targeting to remember, we are not targeting to understand the drug and its uses and all stuff. We are just trying to remember it, like paracetamol poisoning and acetylcysteine, like this we are just going to remember it. Okay, let's start it. Okay, so Coumadin is generally a drug. The first row, whatever are there, Coumadin, benzodiazepine, magnesium sulfate, these are the drugs, and vitamin K, these all are the antidotes. Okay, so if someone asks you like what is the antidote you will give for Coumadin, you need to remember vitamin K. So Coumadin starts with K, that is K for Coumadin. You will give it as vitamin K. K. Okay, K. I guess this is easy to remember. And now benzodiazepine. I'll just remember this benz. I'll just highlight in this benz. Okay, this benz is a car. That is a symbol. Okay, benz is a car. So this benz car, like a girl, she's very rich and she have rich lady got flu. So that's why flumazenil. Try to remember this, how I'm relating. Flu. She got flu and she went for a treatment in a Benz car. Okay, that is benzodiazepine. Flumazenil and benzodiazepine. You can just relate it very well, right? Flumazenil and benzodiazepine. And sorry. And her name is Roma. Okay, so her name is, that rich lady name is Roma. Roma got flu and she went for a treatment in a benzodiazepine. Okay, benzodiazepine, flumazenil and romazicon. K for Coumadin and K for vitamin K. Benz, flumazenil and romazicon. Now the next one is magnesium sulfate. Magnesium ko I'll tell you. Magnesium, it sounds like a magician. Okay, magician, magnesium, or also MAG is magician. Okay, magician ko, like it sounds like a magician, so that's why I'm calling magnesium as magician. Okay, when we are childhood mein, like if we see some tricks done by magician, we used to get attracted so much, right? And so that milk, no, like 80% of the children will not like, I guess. So like if we don't like it, our mom, like they used to relate some story, like if you want to become a magician, like if you want to become so smart like a magician, you should have milk. Okay, milk ko I'm calling it as calcium. Okay, calcium, and calcium mein at least she will add some sugar. Okay, that is gluconate. Calcium gluconate ko magnesium sulfate ka antidote is, magician ka antidote is calcium gluconate, milk. Okay, milk is calcium gluconate. And the next one is heparin. Okay, next one is heparin. Heparin mein I'm just taking this he. Okay, this person will always love to take this protein, that is protamine, protein. Okay, I'm just trying to relate, guys. This is not just for remembering, not for understanding. Okay, you might question me like why protamine means protein or what. No, this is actually I'm just giving you to remember sake only, not for a knowledge sake. Okay, heparin, because smart learning matters a lot in the exam, in like even fmge, even neet PG, anything, smart learning matters. Okay, the next one is this heparin, he loves protein. So heparin is protamine sulfate, protamine sulfate. And Tylenol, I'm telling you this one star mark, I'll tell it later. Okay, Tylenol ka mucomastatus, I'll tell you later, please. Okay, next, the opioids we are trying to know. Opioids is nothing but, you might have had a cough, right? So cough time you will have syrup. So cough syrup is generally opioid. That's why you'll feel drowsy if you take it more. Okay, so opioid is something like narcotic. Opioid, it is a narcotic. So opioid ke liye you will give narcotic. Okay, next one, cholinergic drugs. Cholinergic drug also I'll tell you later in the next slide. I have written it again. So let's read it there. Okay, Tylenol I didn't tell you, I'll tell you later, and cholinergic also I'll tell you in the next slide. Okay, digoxin is something easy, dig. Okay, dig. That's it, dig. That's it, digoxin, dig. Okay. Let's go for the next slide. Okay, Coumadin is vitamin K, Benz, the rich lady, her name is Roma. She got flu and she traveled for a treatment in a Benz car. Okay, and next, magnesium, this magician will always have calcium gluconate. That's the same story our mom used to say. So that's why if we have a calcium like milk with sugar, will become a magnesium magician, like as much smart as magician. Okay, next, this person, he always loves protein, that is protamine sulfate. Next, opiates. Tylenol I'll tell you. Opiates generally have narcotic. Opioid is a narcotic, so narcotic analgesic, heroin and morphine we give. And next one is cholinergic drugs. Cholinergic drugs also I'll tell you later. This one also, Tylenol also I'll tell you later. Okay, next, digoxin, dig. Okay, that's easy to remember. The next one, this one, acetaminophen. Acetaminophen is nothing but paracetamol. Okay, paracetamol poisoning, we give it as NAC. Okay, NAC, NAC. Okay, paracetamol, NAC. NAC, that is N-acetylcysteine. That's it. Okay, next one is iron. Try to remember iron. Iron is nothing but, see, one more thing also you can remember. If they ask you paracetamol, remember paracetamol, another name is acetaminophen. So paracetamol ke liye you will give this N-acetylcysteine. If they give you like acetaminophen only in the question, then it's very easy to remember, that is acid. Okay, acid. That's it. You don't need to just see the question and the options very carefully, you'll remember it. Okay, next one is iron. Iron and deferroxamine. Iron, that is ferric acid. Okay, ferric acid, that is deferroxamine. Iron का poisoning हो गया, उसको like break down करने के लिए deferroxamine, D. Okay, D is like something breaking down. Okay, next, to destruct ferric acid we give, iron को destruct करने के लिए we give D, that is destruct करने का ferroxamine will give. Okay, next one is for isoniazid also we give the same one, deferroxamine. Okay, isoniazid and iron, ये दोनों को we give deferroxamine. So how to remember this? See, IRON, ISON, only S is different and rest of all are same. Iron and ison. Okay, isoniazid. So whenever they'll give you like antidote of isoniazid, like try to see the isoniazid twice or thrice, then you'll remember that is same with iron, IRON, ISON, and then you'll remember this destruct, iron ko destruct karne ke liye deferroxamine. Okay, that's it. Next one is alcohol withdrawal. Alcohol withdrawal ke liye, alcohol withdrawal, like India mein most of the rape cases is because of people who will have alcohol and they'll do this. Okay, they'll do rape kind of shit. So that is because of a increased libido. Okay. Alcohol withdrawal ke liye Librium we need to remember now. So what I am relating for this is people who does rape cases, most of the rape cases because of the person done after alcohol, after consuming alcohol. So alcohol lene ke baad libido will be increased, that is Librium. Okay, so alcohol withdrawal ke liye we give it as Librium. Okay, next one is cholinergics and anticholinergics. See, I said you in the last slide this cholinergic we didn't read, so this cholinergics, so we're going to read it now. Cholinergics and anticholinergics we have. Okay, cholinergics ka opposite one is anticholinergic. Okay, so cholinergic ka antidotes are different, anticholinergics ka antidotes are different. Okay, so first we are going to remember anticholinergics. Okay, anticholinergics is, you might have heard Andhra Pradesh, AP for Andhra Pradesh. A for anticholinergic, P for physostigmine. Okay, anticholinergics and physostigmine. Just trying to relate something with AP. Okay, because P may always it will get confused between pralidoxin, physostigmine, pyridostigmine. These all things it will confuse you. So this AP may P for is physostigmine only. How to remember this? That is, Andhra Pradesh mein these days like YouTube channels are there. YouTube channels mein most of the fitness channels, Telugu fitness channels, they are actually Andhra people. Okay, they are mostly like 80% people are like, until I have seen, they are Andhra people. Okay, P for physical exercises they'll do, so that's why physostigmine I'm calling it as physostigmine. A for A for anticholinergic, P for physiostigmine. Okay. Okay. The next one, AP, you can just remember it as AP also. Next one, yeah, I didn't tell you the cholinergics, right? Yeah, anticholinergics is AP. Okay, P for physostigmine, A for anticholinergic. And cholinergics are again, C. Cholinergics are again, AP will be the here answer. For example, C, A, P. Okay, this became anticholinergic. Cholinergic, if someone asks you, the A for anticholinergic, P for physostigmine. If someone asks you about cholinergics, C will be here. This A will go here. That is AP. A for atropine, P for pralidoxin. Remember, P for pralidoxin. Okay. Here, cholinergics mein pralidoxin will be there. Okay, and A for atropine. Anticholinergics mein physostigmine, AP. A equal to P. A is like anticholinergics is physostigmine, and then if they ask you about cholinergics, that is AP will be here. A for atropine, P for pralidoxin. Okay, that's it. Next, aspirin. Aspirin mein I have highlighted SP. SP. P को उल्टा करना है. This is P. उल्टा कर दिया तो it will become B. Just flip it ups and down. Okay, this bulb will come down, so it became B. Okay, B for bicarbonate. SP is S for sodium bicarbonate. You can just remember sodium, it starts with sodium, but I'll not tell you just to remember with sodium, because there is sodium bicarbonate also, there is sodium thiosulfate. Examiner will always try to confuse you. So that's why sodium bicarbonate also, it's very mandatory to remember, to differentiate between sodium thiosulfate and sodium bicarbonate. Okay, for aspirin, P ko ulta kar diya, it became B, and S is S, just like that. Okay. Sodium, B for bicarbonate. That's it. Sodium bicarbonate. Okay. Next, CCB, calcium channel blocker. Calcium channel blocker ko, see, calcium is milk. Magnesium sulfate ka antidote is calcium gluconate. Yes, calcium gluconate. Next, calcium channel blocker we have. Calcium channel blocker is, calcium is nothing but milk. Yeah, milk mein what all we will put? Milk, this glass has milk, so that's why calcium. Okay, and mummy will add sugar also, that is glucose. Okay, to counteract this, after taking this, to counteract this to glucose level in our blood, our body, pancreas will release insulin. Okay, so that's why these three things are related very well, right? Calcium channel blocker, calcium channel ko block karne ke liye this glass full of milk, that is calcium or gluconate, or इसको after taking this, इसको लेने के बाद, like our pancreas will release insulin, that is insulin. Okay, so calcium, glucagon and insulin, calcium channel blockers का antidotes. Next, cyanide poisoning को we will give hydroxycobalamin and sodium thiosulfate. Okay, sodium thiosulfate. Remember this cyanide and hydroxycobalamin and sodium thiosulfate. That is, cyanide में starts with CU. Cyanide, CY को separate कर दिया तो इसको pronounce करते हम CU. Okay, CU. Okay, cyanide poisoning को we will give TY. Okay, CU means thank you. If someone says you like I'll see you, okay, you should say thank you, TY. Okay, so how to remember this cyanide and hydroxycobalamin, sodium thiosulfate? Okay, first let's remember cyanide and hydroxycobalamin. If someone says you like see you, you should say thank you. Okay, so cyanide, hydroxycobalamin. Okay, and next is sodium thiosulfate. Sodium thiosulfate ko ST I am telling it as. Just now I said sodium bicarbonate ko SB. Now sodium thiosulfate ko ST. Okay, ST for sodium thiosulfate. Thank you, you will say. If someone says you like see you, you will say thank you, and then you will just go to your place and sit there. Okay, ST, sit there, sodium thiosulfate. Next one is hydrofluoric acid. Hydrofluoric acid ke we will have to remember calcium gluconate. Calcium gluconate, somewhere it came again. Magnesium ko, see in the last slide we have remember magnesium sulfate ko calcium gluconate we will give, and again now hydrofluoric acid ko calcium gluconate we will give. Okay, remember your mom was giving you milk and the glass full of milk has fallen down. Okay, fallen down, then the milk has fat and all stuff, so the floor will be like a little bit oily and all stuff. Your mom will scold you, and after that she'll clean this with acid, that is hydrofluoric acid. Hydro is water and floor mein dalne ke liye acid, that is hydrofluoric acid. hydro is water, fluor में डालने के लिए that is acid, that is hydrofluoric acid. Okay, so milk has fallen now. Magnesium जैसा smart बनने के लिए मम्मी will give us calcium gluconate. Okay, that is magnesium sulfate का antidote is calcium gluconate. And now calcium she was giving, and you have you were unable to hold it, and the milk has fallen down on the floor now, and she'll come and she'll scold you. After scolding you, she'll start cleaning it. Like a milk has fat, so that's why the floor has become oily. So इसको अच्छे से clean करने के लिए she will put some water and some acid. Floor में डालने का acid, that is fluoric, hydrofluoric acid, calcium gluconate. Okay. And the next one, insulin. Insulin के लिए glucose will give. This is the most easiest one. Insulin के लिए glucose will give. Okay. Next, methanol के लिए ethanol will give. The rhyming is really good, right? Insulin के लिए तो glucose. This is the most favorite one for everyone. So this is very easy to remember. And the next one is methanol के लिए ethanol. Just M को cancel कर देना, ethanol. Okay. Next, ethylene glycol. Ethylene glycol के लिए fomepizole and ethanol. Ethylene, ethanol, methanol all are same. So ethylene के लिए ethanol we give, and also fomepizole. Fomepizole we give. Fomepizole. Okay. See, methanol का ethanol M को cancel कर दिया. Okay, M को cancel कर दिया. Now ethylene glycol का ethanol and fomepizole. Okay, fomepizole, foamy. Next, methemoglobin. Methemoglobin. This met. Okay, met. Okay, met and met. Okay, next, met. That's it. Next, tricyclic antidepressants. Tricyclic antidepressants का we give sodium bicarbonate, actually NaTe, sodium bicarbonate. Sodium bicarbonate somewhere it came. Where? SP, aspirin. P को उल्टा कर दिया, sodium bicarbonate बन गया. Okay, last slide में. I hope you remember it. Okay, here. Aspirin and sodium bicarbonate, and here the same thing, sodium bicarbonate we can also give for tricyclic antidepressants. Like depression में है, then we give them tricyclic antidepressants. Out of depression they try to attempt suicide by taking lot of antidepressants, tricyclic antidepressants, then we need to give them sodium bicarbonate, S and B, SB. Okay, aspirin का and tricyclic antidepressants का same है, sodium bicarbonate. And the last one, see here, just to make you remember, ट्राइसाइक्लिक एंटीडिप्रेसेंट्स के लिए सोडियम बाइकार्बोनेट, एस्पिरिन के लिए सोडियम बाइकार्बोनेट, बट सोडियम थायोसल्फेट वेयर विल गिव? इफ समवन सेज you see you will say them thank you and you will go to your place and sit. Okay, ST, see you, thank you, ST, thank you मतलब TY मतलब trihydroxycobalamin. Remember, we have methylcobalamin, cyanocobalamin, that is of B12. Don't get confused with them. Okay, we just have to remember this thank you cobalamin. Thank you. Okay, next one, ST is sodium thiosulfate. So cyanide के लिए what all will give? Thank you. If someone says you CY, TY, thank you, and then you will go and sit there. Okay, so cyanide, hydroxycobalamin and sodium thiosulfate. Successfully done with this class. And know about my next classes ka update ke liye, you can just go to this page, Matrix MAATA. That is my Facebook page. You can go there and follow there. And there I'll be posting most of the next class ka updates and all stuff. Biomedical waste, most asked question in fmge, like from PSM subject. So this biomedical waste ko I made it as a story. I'll be making it more better, but this video is really fantastic. You can watch it, guys. Like, this will help you. This will bring you at least 1 mark in FMG and also NEET PG. Okay, thank you guys, and don't forget to go and follow Matrix MAATA Facebook page, where I'll be updating about my next classes, when I'm going to take, regarding what topic and all stuff. Thank you guys, thank you so much. And if to contact me, like, this is my number, you can text me on WhatsApp, then I'll join you in my group, so that you'll be getting all the updates without missing them. Thank you for watching, and let me know your feedback on how it is helping you.